Welcome, welcome, welcome. Welcome to this live. Welcome. Let me know if you can hear me. Welcome, welcome, welcome. I welcome you to the live. This promises to be interesting and not just interesting, um, highly informative so that you can know what you need to know and what you need to do or what you need to be doing on this day and beyond today. So welcome. Let me know where you are watching from. I'd like to welcome you. Let me know where you are watching from. Okay, I believe your feedback will help to determine which one we go for in terms of the audio. It's confirmed that you can hear me clearly. Welcome to the live, and let me know where you are watching from. Who is here? Hello, welcome, welcome, welcome. I'm excited about this particular topic we are discussing at this time. Thank you for joining in. May I know who is joining? Where are you watching from? I'd like to meet with each and every one. Thank you for the like. Thank you so much. I'm trying to be sure that this audio is good. Please give me a feedback in the chat. Let me know if the audio is good. Is the audio good? Let me know if the audio is good. Different options. Okay. So I'll be able to determine which audio we'll be using. Let me know if you can hear me. And if it is clear, no background noise. Okay, thank you for the likes. Just let me know where you are watching from. Who is here? Still welcoming everyone to the live as we settle into this important discussion. Let me know if you can hear me loud and clear. Okay, I'm sure you will like to really know um, something that you probably do not know at this time when it comes to talking about your heart. Do you have any question relating to the heart? Any questions about hypertension, heart attack, everything around cardiovascular diseases. So on this Heart Day, World Heart Day, we are looking at the fact that 80% of heart attacks can actually be prevented. That's the fact, according to many researches that have been done. In fact, the World Health Organization has also made that statement from different reports that most cases of heart attacks are actually preventable. And that's only if what we're going to be finding out in this on this live. And interestingly, today being 29th of September 2025 is World Heart Day. So, what is the heart? Of course, the heart is an organ, like in seated somewhere in the chest, right? We're not going into the details of the anatomy, but of course, everyone knows you have a heart. And then talking about a heart, uh, people talk about someone breaking their heart. There's an emotional side, there's a psychological side when it comes to interpreting the heart. But we are looking at the structure, the physical, uh, that organ that is seated right there in your heart, in your chest, and then doing a lot of work to keep you alive. Okay, so the heart actually one of the organs in the body that helps in sustaining life. It's actually that organ that helps to pump blood to different organs and different parts of the body. Okay, so any um, damage that happens to the heart definitely will affect some organs, many organs, and even the entire life of an individual. So we're talking about that machine, so to say, that pumps blood from, okay, I describe it this way. There's a way the blood that is circulating through your body, through my body, actually helps in building, in growth, when it comes to the cells in your body, when it comes to organs performing their functions. So there's a flow of blood. So the fact is that without the heart doing its work efficiently to pump blood to other organs or the entire system, then there may be some failure in the performance, circulation, even the kidney function, uh, name it, different organs in the body. So, how important is your heart? My heart. How important is this organ? Okay, the World Heart Day this year's theme says, "Don't miss a beat." I'm sure you don't want to miss out on information on this live, so stay tuned as you join in, and we welcome people as they come in. All right, so you don't want to miss a beat. This to emphasize the importance of paying attention to your heart. Interestingly, looking at what the Bible says about the heart, the Bible talks about out of the abundance of the heart, the mouth speaks. Interestingly, physically speaking, out of the richness, the substance of your heart, other parts of your body can actually receive. Okay, so you are as healthy as your heart. You are as healthy, of course other organs are important, but you are as healthy as your heart. You are as healthy as the blood that is flowing from your heart to different organs in your body. And interestingly, okay, I hope my mic is working. Please let me know in the chat if you can hear me. I hope I'm quite audible. Please let me know in the chat. Welcome, and let me know who is joining in and where you are joining from. Where are you watching from? All right. So as much as possible, you need to understand that when your heart is right, when your heart is healthy, then of course, as a matter of fact, the blood circulating, being healthy, there's something we call oxygenated blood. That's the blood that actually contains oxygen, nutrients that help the other parts of the body to perform their function. All right. So if your heart refuses, not your heart now, if the heart of an individual refuses to perform its function, then you can imagine that there will be some lack in the functioning of other organs in the body or even the system as a whole. So if the heart of an individual fails, then that's a danger point. It means that some other organs in the body may fail, and then that individual may not last. All right, so this is very important. It's something that we need to pay attention to. Interestingly, we are talking about cardiovascular diseases. Cardiovascular diseases are the most common cause of mortality. That is talking about deaths all over the world. That's talking about cardiovascular disease, talking about heart attack, hypertension, myocardial infarction, heart failure. But of all, hypertension is actually the leading cause when it comes to cardiovascular diseases. There are so many risk factors. There are different risk factors for developing a heart disease, including genetics, including genetics, including increasing age, including lifestyle. And that's a major aspect when it comes to the risk of cardiovascular diseases. So saying that 80% of heart attacks can be prevented, not just heart attacks, hypertension can be prevented, stroke can be prevented, kidney failure can be prevented when some things are done. Only when some things are done. All right. I keep saying this, that as much as possible, we have the gift of life. God has given us the gift of health. This body, your spirit, your soul, your body. But we have responsibility. Responsibility to take care of this body. You have a responsibility to take care of your body. So if you are not doing the needful, uh, for example, we talk about uh, nourishing things around you. Maybe, for example, you have a farm. You want to ensure that you are doing the needful to ensure that that farm brings up the necessary whatever planting that you have on that farm, whatever crop that you have. But how much attention do we pay to our heart? Do you pay attention to your heart? Do you pay attention to your heart? That's the question I'm asking you this time. Do you pay attention to your heart? Many times we pay attention to the external. We pay attention to how we look, how what people see on the external, but very few people pay attention to their heart. Now, if you really want to live life and enjoy life, it's not just about the psychological aspect, the the emotional aspect when it comes to your heart. I've said earlier that some people describe the heart as that emotional side. Okay, somebody breaking somebody's heart, not physically breaking the heart, but doing things to hurt another person. They say, oh, this person broke this person's heart. Somebody broke a relationship. They describe it with those terms. But we're talking about the physical side of your heart. Terrifier, what's up, dog? Do you use Viagra? I don't use Viagra. Hello, Terrifier. Good to have you here. Thank you for joining in. First to drop a chat. Thank you. Where are you watching from, Terrifier? I'm sure this is not your first time joining my live. So, but where are you watching from? Let me know. And please confirm that you can hear me clearly. Let me know in the chat. Okay. So it's very important to note that in as much as you take care of the external, uh, the internal, those organs on the inside that we do not see are as important as the external organs. In fact, they actually are, in quotes, more important. Every part of your body is important, okay? But there are, for the heart, for example, there's some form of protection. There's a form of protection that has been put in place there by God. And then you look at the muscle, the muscular structure itself, you look at the blood vessels, you look at the covering, lining around the heart, you look at the muscles and the ribs. Okay, so those structures give some form of protection for your heart, and that is one of the ways to understand that uh, God in his mercies has actually designed it in such a way to show how important this organ is. You know, other organs are also important. So that's why that protection is there. So we must, as individuals, be doing the needful. Be, you must ensure that you are nourishing your heart. And we'll be talking about how to nourish your heart. Okay, so many data are now available when it comes to uh, billions of people developing cardiovascular diseases, talking about heart-related conditions. Like I said earlier, cardiovascular diseases are the leading cause of mortality all over the world, irrespective of your race, irrespective of where you live, your location, irrespective of your status. You know, globally, cardiovascular diseases are the leading cause of death, and hypertension is the leading cause of all these cardiovascular diseases. So why would an individual develop a heart attack? Why would an individual suffer from a heart failure? You know, we'll be looking at why. Okay. Now, when the heart fails, of course, as I mentioned earlier, uh, let me describe it as the heart trying to do extra work, forcing itself to pump blood, is trying to adjust. And that adjustment is as a result of many things, and including especially hypertension. Okay, so I talk about this a lot. I'm interested. You know, there are a lot of information out there talking about the predictions, about the likelihood of more individuals developing hypertension all over the world, and the risks are there. Okay, until something is done, I mean, individually and then corporately, as families, as communities, as nations, health 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 enthusiasts generally should be committed to seeing that these predictions do not actually come to be. So only if we are going to do our part, because God is always faithful, He has given us the gift of health, He has given us all that we need, in fact, to nourish our hearts. Okay, so on this day, World Art Day, welcome everyone. If you are just joining in, kindly give this live a like and let me know where you are watching from. Let me know if you can hear me clearly. Let me know if I'm audible. I will appreciate your feedback. Thank you so much. So, how do we prevent sudden deaths? How do we prevent heart attacks? How do we avoid uh, people developing complications from cardiovascular diseases such as hypertension? You know, it begins with doing what is happening at this time. I'm using this platform, for example, YouTube, to uh, educate people globally. Of course, information is there. Different health professionals are making information available. Even those who are not health professionals making information available. So, if we are going to live healthy lives, if we are going to have nations, generations, communities that are healthy, then we must be talking about these things. I mean, it's very good that we entertain ourselves, that we try to enjoy our lives. Of course, we should laugh, and that is healthy. We should We should enjoy drama. That is healthy. But if we fail to get appropriate information, education on how to live our lives in such a way as to, I did a video on um, the top 15 countries where people live longest. Talking about uh, the number of countries where people actually have higher life expectancy. So in that video, I talk about different lifestyles that people have, different ways. And one of the things that I recognized from studying these countries is that most of them, the people have social connections, which is very important. So there's nobody that should be denying that fact that we are social beings and we need to relate as such. We need to connect with our world. We need to enjoy our lives. You need to find time to rest. You need to find time to relax. And if you are not doing that, you are not living a balanced life. Okay. So if you are going to say you are a whole person, I do not see wholeness according to even to the World Health Organization. I don't see wholeness or health just as the physical. Okay, there is the psychological aspect, there's the mental aspect, and there is the emotional aspect, the cognitive aspect, there is the social aspect, there is the spiritual side when it comes to our health. Okay, so what are you doing in your own way? you know this is not a dancing session, but I wish more people could join in. I know there are people coming in, um, checking and going out, and then there may not be a real reflection of the numbers. But I wish we could have more people watching this right now, listening to this, and learning and asking questions, because this is one of the ways to learn what to do and to take responsibility, to take action. I mean, so that the statistics can change, so that the numbers can change. 1.4 billion people are said to be suffering or dealing with hypertension. And interestingly, half of that number have not been diagnosed. So people don't know that they are hypertensive. People don't know that they are having high level of blood pressure. People are not even checking. So when was the last time you had a blood pressure check? So that's the question I'm throwing at you. When was the last time you had a blood pressure check? You can drop in the chat. Let me know when was the last time you had a blood pressure check. Okay, so what is actually recommended generally, if you are not hypertensive, normally it's at least once in a month you should have your blood pressure checked. So how do we enjoy our lives? How do we get to live long and enjoy life? We need to live right. We need to be doing things right in such a way as to let God know that we are good caretakers. We are responsible people, that He can trust us with the things that He has given to us. I mean, with the life that He has given to us, with the organs that are there in the body, that the way you decide to treat your organ can determine how far, how well you live. So, what are the things that we should be doing right now? You should be sharing this live. There's a link to share it with somebody around you. You should be sharing it with people around you, your loved ones. Okay, it's good to be back. Apologies for the network challenge. Welcome back. Let me know if you can hear me now. I hope I'm audible. Welcome, welcome, welcome. Let me know where you are watching from. And I would like to take your questions, like to take your comments relating to this topic. It's such an interesting topic, not just interesting, it's a topic that we should be talking about. Looking at the gravity and the global impact that this is making on health. So let me know where you're watching from. Thank you for joining in. I hope you like my mic. Okay. I hope it's doing the job. So welcome or welcome back, depending on who is joining in now. Okay, welcome. Let me know who is here. Who is here? All right, were you here earlier? We started talking about cardiovascular diseases. Today's World Heart Day, and emphasizing the importance of taking good care of ourselves, and especially considering our heart. So you need to pay attention to your heart. You need to nourish your heart. You need to feed your heart. We use those terms in the spiritual sense, but physically speaking, your heart should also be nourished. You are a reflection of what you eat. Actually, your heart is a reflection of the things that you feed it with. When it comes to the spiritual, when it comes to the emotional, is what you feed or expose your heart to that will determine what you reflect psychologically, emotionally, even spiritually. Okay, so how much of nourishment, of the right nourishment, are you giving to your heart? I was saying earlier that there are a number of people here, even if you are joining in and you don't have hypertension, never been diagnosed of any medical condition, that's great. But you may actually have someone around you, a friend, a family, a colleague, someone who has probably been diagnosed of hypertension, who is currently being managed for hypertension. You may even have people who have developed complications from hypertension. You may have someone who has even passed on from the complications arising from poorly managed hypertension. So this message is important for every one of us, not just you, but even those around you. Now, because the impacts of this uh, poor attitude or lack of commitment to taking good care of your heart may lead to uh, unpleasant experiences. Okay, quite a number of people who were diagnosed with hypertension but refused to do the needful, later developing complications. Some even had to pass on earlier than the time because the needful was not done. Okay, so but we need to understand what we are dealing with, what we need to be doing, how to prevent, how to stay healthy, and for those who have been diagnosed, how to manage appropriately. what to do, what to be doing, and what not to do. Okay, the impact, talking about the disability, the loss in work hours. In fact, even for those who are even students, because hypertension, for example, is now becoming a common finding in even the younger adults. Okay, and the reason is not far-fetched, or the reasons are not far-fetched. The fact is that we are becoming more sedentary than ever before all over the world. Talking about the use of our devices, whether you're a content creator, or you are a student, or you are a professional, somehow, somewhere, you just have, for example, I'm using my mobile device now to do this, and I'm sitting, though I can choose to stand to do this, but most of the time, you know, depending on your profession, really, you are likely to be more sedentary than ever before. Now, there's more room for remote people working remotely, people working from home, from wherever you are on the go. You can work on your devices, just sitting there. And so the risk of being overweight, the risk of becoming obese, those risks are there. Lack of real physical activity. These are risk factors for developing cardiovascular disease. Thank you for the likes. And here, who do we have here? Sibuna. Wow, where have you been? Sibuna TV says, hello, doctor. Good evening. A very good evening to you, Sister Ebun. Good to have you here. Thank you for joining in. How have you been? Yeah, it's been a while. Great to see you. Yes, thank you. Thank you. Thank you so much. Good to have you here. I really appreciate this. Thank you for joining in. Did you get a notification, or were you just scrolling? How did you get to know about the live? Sometimes, I say this, that we may need to check our settings to be sure that we are still having the right settings for the channels that we are subscribed to. Okay, we need to be sure that we have all notifications on, to get notifications. Okay, and I've had that experience different times. I've had to check that there are some channels that I found out that I have not been receiving notifications or seeing them on YouTube, not because they are not probably creating content or uploading or showing up, but maybe because I don't have my all notifications on. So you can have no notification, you can have personalized notifications. Those are the options available. But when you do all notifications, and that happens when you click on your subscribe button, you tap on it again, it will show you the options, and then you can click on all notifications. So if you are just subscribing to the channel, thank you for subscribing. Welcome to this great community, LD and health enthusiasts, LD people. Okay, that's our goal, living healthy. And you can do so much with a good health, with great health. You can do so much. Okay. So if you have subscribed, please check on that subscription again to be sure that you have all notifications on, so that when I come up live, you can be notified. And when videos are uploaded, you can also be notified. Thank you for doing that. I mean, I have great people, members of the family, showing up tonight after a long, it's been a while. Thank you for the feedback. Okay, you said you've been out. Okay, I am missing. Let me check the messages. Yeah, it's been a while. Great to see you too. Thank you for the like. I just thought to briefly say hello. Thank you, Sebuna. Thank you for saying hello. And you said you've been in and out of YouTube, but you're working on consistency. That's it. We need to just understand that life may make things change. Okay, and there's no one at, no matter how much you have done so far on YouTube, you just find out that you still need uh, those moments when you have to pay attention, more attention to some other aspects of your life. So seasons change, and that is understandable. All right. Thank you for not just passing by, for engaging. So hope you will be able to meet up with your plan for consistency this time. Sibona, well done. And great conversation too, Doctor. Thank you so much. Thank you, Sibona, for the feedback. I say that's true. Oh, okay. True about the subscription and notification. Yes, this is the best and most resourceful health related YouTube channel. So let's like, subscribe, and drop your thoughts. Thank you so much. Thank you, Sebuna. Thank you. Thank you. Well appreciated. Okay, let me pin your message. All right. So we keep trying. Sometimes I'm asking myself, uh, is this really true? I know you're not saying what is not, but sometimes I'm just thinking, man, I'm not giving enough yet, and I look forward to doing more. All right, and I'm sure um, the YouTube company is taking note of that. You know, I've been 4 years on YouTube, and we are not we are not giving up. Okay, we keep at it. I mean, we need to let the world hear. People need to know, people need to be educated, people need to be well informed, people need to take right decisions regarding their health. A lot of information out there. People, in fact, I call some people doctors around, doctors in the house, doctors in the office, doctors in the family who are not actually uh, licensed doctors. You know, people give different suggestions on what to do, recommendations, remedies, natural, unnatural, different approaches to um, health. Okay, so but we find a way as doctors, we find a way to uh, handle all this together and give what is necessary to the person or individual concerned. So you're welcome, Doctor. Thank you, Sebuna. Hey, Sebuna says you are doing an exceptional work, Doctor. God bless you immensely. Amen. Amen. Thank you so much for your comments, wonderful comments, and for the prayer. So we don't, okay, exactly, Doctor. We don't have too many honest doctors who actually care about our health and not just profits. It is well, okay. That's interesting. So some of these things um all depends on where each person is coming from. I had the opportunity to do so many other things, but doing medicine, practicing, studying medicine, practicing as a doctor is just one thing I know God had or has for me to do. Okay, so I am enjoying it and I am doing it, giving my best to it. So anytime I have opportunity to interact with anyone relating to their health, I try as much as possible to give my best. Okay, so this is just a tip of what I do when it comes to interacting with individuals or patients or clients, as the case may be. Okay, so I'm really passionate about this. I'm committed, and I'll keep trying my best. In the midst of the busyness of life, obligations, clinical work, different assignments here and there. All right. So I really appreciate your feedback, and I don't know what more to say. I will say thank you, thank you, thank you, thank you very much. Okay, doctors who actually care about our health. Yes, the fact is that people have different personalities, different understanding, different factors that may influence the way you are being treated by a doctor. Okay, So we need to understand that. Just a minute. Okay, I believe you can hear me. If you are here to give this live a like, kindly give it. I'm sure you will be finding it interesting if you are just joining in. And if you have been here, why not? Let's know uh, who you are and where you're watching from. Thank you for the feedback, Sebuna. Sebuna says, exactly, doctor. We don't have too many honest doctors who actually care about our health and not just profit. Of course, there has to be a balance, when it comes to making profits, um, doctors being honest. There's so many things relating to that. Okay, but people definitely, doctors want to also be paid for their services, considering even the cost to uh, the doctor or the facility that may be referring to. So it's just like any other profession. Some people will even say not like any other profession. Uh, Looking at the demands relating to giving clinical services. All right. So maybe that's one of the reasons why some of our people are enjoying the Japa syndrome. Okay. So we just need to understand some of these things. Okay. Welcome. If you are just joining in, thank you for joining in. Let me know where you're watching from, what is your location, what time it is in your location. Thank you, Sebuna. Sebuna says, well done, sir. Thank you so much, man. It's good to have you back with us. All right, so many of the deaths that occur from heart problems, let me put it that way, are actually preventable. Heart attacks are preventable. Many of these cardiovascular diseases are preventable. But I've talked about the impact that the complications that may arise from not doing the needful to prevent these conditions or even manage the condition appropriately. The impact is not just on the individual that has the diagnosis, the impact is on families, friends, communities, even the nation at large. So imagine people in their young adults, talking about people suddenly falling, slumping, you know, people just passing on from these conditions, the loss to family, the loss to community, the loss to the nation. Nobody actually prays or desires or wants to live uh, to live below the number of years that God has actually designed or planned for us to live. We want all to live into our old age and in health, in wealth, and to pass on peacefully. Okay, but these days you find people in their 40s, 50s, even 30s sometimes, people in their 60s passing on. Okay, there are many reasons why people pass on. But when it comes to cardiovascular diseases, the fact is that it is the leading cause of deaths all over the world. So why shouldn't we be talking about this? Why shouldn't we be doing the needful when it comes to our health relating to these uh, area. So what are the things that we should be doing? We have to be committed as individuals. We have to be committed as families. We have to be committed as friends. We have to give necessary support. All right. So it begins with you. You know, you don't miss a beat. Your heartbeat is important. Now, let me quickly mention some of the symptoms of cardiovascular diseases. When an individual's heart is not performing as it should, these are some of the symptoms that the individual can have. Welcome, Akman87. Good to have you here. Thank you so much. Thank you for tuning in. I'm doing great. It's an interesting discussion I'm having here with the community and everyone. People are just joining in. People are just coming across the channel. This is World Art Day. World Art Day. And we're talking about the importance of our heart to our overall health. Thank you, Akman87, saying I subscribed. Wow, thank you so much. Thank you for subscribing. I'm so glad, excited about that. Thank you so much. Thank you for joining the community. Okay, please, you can tap on that subscription again, that subscribe button, and get to click on all notifications. It will give you option for no notification. It will give you option for some notification or personalized notification. Um, but the first on that list is all notifications, right? Please click on all notifications. That way you will get notified whenever I come up live, whenever I upload on any video on YouTube. Okay, so thank you so much. Saying may God bless you. Amen. Thank you, Akman. Where are you watching from? Akman87. Please, where are you watching from? Let me know where you're watching from and what time it is in your location. If you are joining us and you are yet to give this live a like, kindly double tap on your screen, like the live. You can even share it with your community. We're talking about our hearts. Talking about our hearts. How important is your heart to you? Okay, people relate with this on the relationship side, on the emotional side. Oh, my heart is hot. My heart is, people use different expressions relating to the emotional side of the heart. But we are talking about that physical structure, that organ, or the muscular organ with different chambers, different muscular parts, different blood vessels, blood supplying to it, and itself being a major uh, source or channel of blood supply to different parts of the body. So you are as healthy, you are as fit as your heart. So how important is your heart to you? So we must be paying attention to our heart. We must understand the background. We must understand the need to pay attention. So I'll be talking about this. Okay, it's been described as a message that we need to stress and emphasize. I'm placing so much emphasis on this. Oh, Akman says, I live in Dubai, so it will take more time for you to see my comments. That's interesting. Interestingly, yeah, sometimes there's usually this delay in the the number of people on the live. The the system does not show. Sometimes you think that there are just two people now, but interestingly, you find out that there are more. By the end of the live, you see that it could have been like 1,000 people who have joined the live. All right. But I believe that sometimes it actually reflects. So, but even when you post a message in the chat, there may be a bit of delay, just like you said, but maybe not as long as the time it takes to travel to your location. Okay, so I really appreciate your joining. Just give me a few minutes. Oh, okay. What about now? Interesting. So I was muted. What about now, Akman? Thank you for the feedback. Can you hear me now? Oh, okay, it's better now. Thank you so much. I didn't know. I didn't know I was muted. All right. So I was saying that the impact that the cardiovascular diseases actually has on the 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 health of any individual, the impact cannot be underplayed. Not just about the complications, the lives that are being lost from these diseases. Okay, so paying attention to your heart is very crucial, very important. You know, it is that channel where blood, nourishment, oxygen gets to other parts of your body and even other organs. So, what are the symptoms of a heart that is not in the right shape? You know, I just use that, I just describe it that way. When the heart of a person is not in the right shape, let me start with this. Um, Chest pain, even though chest pain may be caused by many things, but chest pain is a common symptom when it comes to heart conditions. So that's why sometimes you find somebody who has had or is having a heart attack, or somebody who is having myocardial infarction. Uh, the fact is that because of the blockage in the blood vessel supplying a particular part of the heart, the individual may feel lack of blood, oxygen, and nutrients to that part. And then there is a message, a signal that is sent to other parts of the body, including the arm, then to the back. So the individual may feel pain, not just chest pain that may radiate to the arm or to the back. So I don't know if you have ever had such a pain or you know someone who has had such a pain. So when you know an individual or you find someone around you complaining of chest pain frequently, it's not something to joke about. Okay, chest pain can also be from lifting heavy objects, can be from ulcer, peptic ulcer disease, can be from gastritis, can be from, gastro gastroesophageal reflux disease, you know, heartburn and all. But we are talking about heart conditions that also give that symptom. Now, apart from that, some people have shortness of breath, breathlessness. You know, people that are able to actually walk some distances before, individual now not being able to walk such a distance again. Even though we talk about age factor, other age group, but even within the same period, the individual that usually would climb a staircase will climb some stairs, now finding it difficult to climb stairs. Now that's a sign. Breathlessness, difficulty breathing is also one symptom of a heart disease. Okay, Akman says, can I get a shout out in one of your videos, please? Okay, Akman, I'll check out your channel and see. Um, Let me screenshot and see what you do and see what I can do about that. Thank you for the request. So what do you do on your channel, Akman? What do you do? Is there any medicine for chest pain? Okay, that's the question you're asking. Yes, there are different, you know, there's a disclaimer here. I'm a medical doctor though, but I'm not going to say specifically use this medication for this, but depending on the cause of the chest pain can be treated. You know, there are some that can be that need to be managed on a long-term basis. There are some that are actually emergencies, chest pain from a heart attack, um, myocardial infarction is an emergency. So, such instance, the individual needs immediate depending on the cause of the disease. When you look at this symptom, some people have palpitations, beat. So when you are normally you shouldn't hear your heart beating. So when you begin to hear your heart beating, then you should know that that's not normal. Some people who are anxious also may have palpitations. People who have thyroid disorders may have palpitations. These are uh, may also be common in certain conditions. But when we begin to look at somebody having a chest pain, breathlessness, also having palpitations, then we'll be looking at evaluating such a patient or individual for a heart disease. Now, apart from the breathlessness can also occur with effort, exertion, or with or at rest. And interestingly, some people even have some level of breathlessness when they try to sleep. Oh, the camera is lagging. Okay, Ackman says you just do some funny content gaming or an edit in my channel. I didn't get that. Okay, you do some funny content gaming or an edits in your channel. Please, could you explain this better? Are you saying that's what you do on your channel? That you do gaming content? Okay, hope the camera is better now. Okay, you do gaming content. Okay, I'll check out your channel. Okay, at the end of this live. Okay, noted, Akman. I do health content, so I'll see how what you're doing can relate or fit into what I do. Okay. Thank you. The camera hope is better now, not lagging. All right. So thank you. We're talking about symptoms of heart disease. I've talked about chest pain. I've talked about difficulty breathing. I've talked about palpitation, easy fatigability. When an individual begins to get tired easily, that's also possible symptom of cardiovascular disease or a heart condition. Okay. Other symptoms may include um, not just easy fatigability now. The individual may even feel tired, weak enough as to feel dizzy, and even may faint. So fainting will also be another symptom. Other common symptoms will include, of course, uh, the the inability to perform tasks normally that the individual will perform with a good heart. Okay, but when the heart begins to fail, when there's a heart condition, the individual may not be able to do tasks that they would normally do. So Akman says, I like to help other people to be viral in YouTube. Oh, okay. Thank you so much. That's interesting. So how do you do that, Akman? How do you do that? All right. So those are some of the symptoms of cardiovascular disease. When it becomes complicated, individual may even have cough, An individual may have abdominal swelling, facial swelling. Individual may have either swelling in the feet. Okay, so those are some of the symptoms that an individual with a heart disease can have. So we're going to be looking at some of the common questions that people ask. Now, having established the fact that hypertension is the leading cause of cardiovascular diseases and is very common, um, it, it affects about 1.4 billion people, adults worldwide, and half of these people have not even been diagnosed, and then half of that have are not receiving adequate treatment. They don't have a control of their blood pressure. So hypertension is actually described as a silent killer. Okay, silent in the sense that uh, it's usually sometimes an incidental finding. People don't have symptoms, but by the time an individual is having symptoms of hypertension, they may actually be having complications at that point. Okay, have you seen someone, or you as an individual, are you experiencing frequent headaches? That's maybe one symptom that you may be having, or an individual may be having from elevated blood pressure. So when the force of blood that is pushing through the arteries is too high, higher than normal, then that is high blood pressure. So that helps. It actually does not help the heart. It makes the heart to do more work, trying to pump blood because of that pressure. And then it's important to note that when you do a blood pressure monitor check, the value of less than 120, less than 80, that's systolic and diastolic, the values. The first one being that when your heart actually contracts, and then the second being when your heart relaxes. That's how we get the values. So it's normal if you have a blood pressure reading of less than 120 over 80. And of course, that systolic shouldn't be less than 90, and the diastolic shouldn't be less than 60. So when this 90 to 120 or 60 to 80, when values are above that, the individual can be described as having elevated blood pressure. If it is still between 120 to 129 of systolic and less than 80 for diastolic. Why high blood pressure actually when it's higher than 130 over 80. Some people actually have levels as high, measurements as high as 180 over 100. That's an emergency. Of course, there's something we call hypertensive emergency. The individual may have some symptoms associated. Then there's something we call hypertensive urgency. The individual may have high level um, 160 over 90 blood pressure, but may not have symptoms. So there's a way each one is being managed. All right. So, but if you have values already reading consistently above 130 over 90, then you should consult with your doctor. So, let me just read some of the frequently asked questions. Can stress cause high blood pressure? Okay, I've seen patients come to the consulting room and then having high blood pressure. They say, "Oh, doctor, but I'm not stressed. I don't feel stressed." Okay, stress, yes, it's known that stress will be a factor for elevated blood pressure. So it can actually be a temporary trigger, and then but chronic stress can also lead to poor sleep, overeating, and then make that blood pressure to remain persistently high. So stress can cause it. So that's why when people rest, when an individual is able to rest well and the blood pressure is checked, it's usually better compared to when an individual has been involved in any form of stress. So that's why when your blood pressure is being checked, it is recommended that you rest at least 5 minutes before measurements. And there are different ways, things that you need to note when measuring your blood pressure. I may have to do a video on that, so I'll let you have that. All right. So now another question is, can an individual have hypertension without symptoms? Yes, it's possible. That's what makes high blood pressure so dangerous. It's that's where the danger is. People don't have any symptom. The individual does not feel any pain. Some people have already attached their headache to elevated blood pressure, and that's one reason why some people don't take their medications, because the symptom is not there. So they drop their medications, and when they feel the symptom again, maybe headache, then they pick their medication again, which should not be. That's not the approach to taking medications. So most people feel fine, they feel good, no headache, no dizziness, but suddenly they may develop complications. So that's why it's important to check. So another question is, can high blood pressure cause headaches? Yes. People often ask that question. Of course, it can cause headaches when it's high, extremely high. Um, but headache is not the only symptom, it's not just the reliable symptom of hypertension. So how often should I check my blood pressure? People ask that. At least you should check once in a month if you are not hypertensive. If you are at risk, then you may check more often. Then if you're hypertensive, you may check daily or weekly, depending on your doctor's recommendations. So, but checking is important. People are not checking. People are so involved or engrossed with work and life that they do not take this seriously. And a lot of deaths can be prevented if these checks are done. And for those who have elevated blood pressure findings could be managed appropriately. So, what are the foods that raise blood pressure? So, some foods actually do raise blood pressure. The effect of salt, especially sodium salt, on blood pressure cannot be overemphasized. So, that's a major factor when it comes to developing high blood pressure. So, highly salted or salty foods, processed foods, snacks, even sugary drinks, red meat can actually drive the blood pressure. So, if you are in Nigeria, for example, what are the things that you should be avoiding? You should avoid things like, I'm going to mention brands, but you mention noodles generally, soya, salty things, processed foods, fast foods. We are in a fast-paced world, and everything fast, fast, fast. But interestingly, these fast foods are not actually healthy. So foods, what are the foods that actually lower blood pressure? Naturally, the grains, they don't taste sweet, but they are actually good. And interestingly, they can be prepared in a way as to be good and fitting for your taste. So grains, beans, bananas, which contain a lot of potassium, whole grains, fish, low fat dairy, they are rich in fibers also. So what are the foods, healthy hard foods that may be available in your environment? If you are in Nigeria, for example, ugu, beans, or fada rice, very good. If you are in the United States, spinach, oatmeal, salmon, fish, these are available too in Nigeria. Do I have to use BP drugs forever? That's a question that someone may be asking, and people know this, that once there's a diagnosis of hypertension, uh, the 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 way your doctor tells you usually is that these medications you have to keep taking it. Some people don't want to hear that. Take it for life. Of course, there are occasions where by there may be a change. There may be a change in intake or prescription. For example, in pregnant women, a pregnant woman may develop hypertension in pregnancy, and by the time following delivery, they may need to uh, go off medications once their blood pressure is under control without medications. Other people groups include the older age groups. As people age, sometimes over time they may lose um, that high level of blood pressure, and they may need to have reduction in the number of pills that they take after proper review by their doctor. They may even be asked to stop. So those are occasions where individuals can stop. So, but we find out that many people who have been diagnosed of hypertension, and you need to hear this, many people, at least from my little experience, usually decide to stop their medications for one reason or the other. For one reason or the other. And some end up developing complications. Some don't even have the opportunity to tell the story, they just pass on. So it's important to note that uh, if even if caught early now, and lifestyle changes can be done for some people who have the borderline, say 130/80, 140/90. you know some people can still manage if they don't have other risk factors, other risks, including diabetes, high cholesterol levels. So such individuals can be monitored, and lifestyle changes, and that's what we are talking about. 80% of heart attacks can be prevented. 80% of cardiovascular diseases can be prevented. 80% of strokes can be prevented where there is a commitment to this um, lifestyle approach. Okay, so what are these things that we should be talking about? Talking about um, proper diet, balanced diet, healthy plate. Talking about 50% being vegetables and fruits, 25% being carbohydrates, 25% being protein, and some low fat. So if you are doing your healthy plate, you take water more, you reduce salty processed foods as much as possible, you avoid alcohol, you avoid smoking. These are risk factors for developing hypertension. So if an individual can also exercise, the recommendation for moderate intensity exercise is at least 5 days or in a week of brisk walking. If you can cycle, cycling is also good. Swimming is good. These are important exercises that can be done. What else? Avoid stress. Next, you should also avoid skipping. This skipping now. You need to ensure that you are getting your adequate night rest. Very important. So sleep deprivation is another factor that may cause high blood pressure. So another question is, can hypertension be reversed? Can hypertension be reversed? Yes, yes, with early detection, with those lifestyle changes I mentioned earlier. If you are overweight, weight control, it's actually been proven that some reduction in kilograms. Say if you lose 10 kilograms over time of weight, then you may be losing 5 to 7 millimeters of mercury drop in your blood pressure. So these are very important factors. So those are some of the questions. Let me see if there are other questions that I can respond to. Right. So what should an individual do when they have the symptoms that I mentioned earlier, or if they are uh, receiving a diagnosis? So it all depends on the diagnosis and then other comorbidities. Those are the things, other conditions that may be associated or related to the heart condition. So the management will depend on those different factors. So having that diagnosis is not the end of life. It only means that there's a need for attention to be placed on the the necessary changes that should take place. Okay. So, what are the complications that can arise? So, before we go there, what should a person do if they have a diagnosis of hypertension? The first thing is to have a clear understanding of what it is. That's one of the things that we've been trying to do. And definitely get clarification from your doctor to know what the diagnosis really is. Maybe try to find out the possible cause, and then what you need to do or to be doing now if you have that diagnosis. Okay, so it's not the end of the world. It's not a time to get into depression or anxiety, which can worsen whatever heart related diagnosis that you have. All right, so you can always lean on God, strength. You can always receive support from family and friends. Okay, there are people who have been on medications for hypertension for 30 years and even be more, and they have really done well into their old age and without complications. So, but all these um, factors, the management depends on your particular diagnosis and the peculiarity that may be attached to the treatment that you need to take. Okay. Okay, sorry for the break. Now, welcome back. Someone be asking so how is high blood pressure diagnosed? So measuring your blood pressure, as I mentioned earlier, and then considering those values, it should actually be like two or more readings to be taken. And interestingly, there could be like 24-hour monitoring that can also help. So how often should you check? I've talked about how often you should check. And then for those who are at risk, how often you should check. So can blood pressure vary during the day? Yes. It's usually lower um, as you wake up from sleep. But as the day goes by, you are likely to find out that blood pressure is increasing. So there should not be any challenge with that. And interestingly, most of these medications, as I mentioned during the live, that they do not, you do not need food to take them. That's talking about most of the oral antihypertensives. And then you preferably should take them in the morning, except you have instruction from your physician. Different from that. What is white coat hypertension? Now that's when blood pressure. Have you seen people? Someone come to the hospital and say, "No, my blood pressure is not usually this high," and then you're wondering what they are saying. But as a doctor, I can tell you that there's something called white coat hypertension, and there's something called masked hypertension. So the white coat hypertension. Um, Now I can see our expert here. Permission to pause and salute and welcome Tech Informant. Wow, good to have you here, sir. Good evening from this side. I hope you're having a pleasant evening too. Wow, good to have you here, sir. Thank you for joining in. Where are you watching from? I like to ask that question. Okay. Um, I don't know where you are currently, but I really like to know where are you watching from. At what time is it in your location? But I'm so happy to have you joining this live. I'm not sure I can remember the okay, maybe you've been joining but not dropping a comment. Last time you just okay. Wow, you just finished your live. I didn't notice that. I'm not sure I got any notification. Okay, okay. Maybe an impromptu one. I'm not sure it's part of the schedule that you have. Today is a Monday. Okay. Usually we get to see notifications. Okay. Wow. How was it? Just finished the live. I believe it was an interesting session as usual. Very informative, educational for content creators. I've been learning a lot from you, and we thank God for all you do. I believe the people had you had a great time together. And then you say you're joining from Lagos, live from Lagos. Thank you. Streaming live from Lagos too. It's good to have you, sir. And we're talking about World Art Day. We've been talking this like moving to close to 2 hours on this live, and it's been interesting talking about why we need to know and the things that we actually need to know regarding our hearts. How precious is your heart to you? I'm sure it is. Okay, and I said earlier that people use um, these arts to express different things. Talking about maybe someone being hurt and they say you hurt my heart. Somebody broke somebody's heart. They're not talking about the physical, uh, the organ sitting there in the chest, but talking about an emotional thing, experience, talking about a psychological effect that they are getting from a relationship or something. All right. So, but it is very important. So it shows how important the heart is. In fact, the Bible talks about out of the abundance of the heart, the mouth speaks. So it shows that there's something about this heart. It's so important. It's even very important for any individual when it comes to living healthy. It is the pumping of blood from your heart. Uh, that blood that contains oxygen, contains nutrients, that helps to supply other parts of your body. And so, if your heart is not in shape, for any individual, your heart is not in shape, then you will not be living uh, as healthy as you should. So, when somebody has a heart failure, uh, then you can imagine what could be happening to the individual relating to other organs or the system as a whole. So thank you, Tech Informer. Tech Informer says, yes, yeah, we did. Yeah, good to know. Wow, good to know. Good to know. I'm not surprised that people and then you enjoyed the live. I'll check the replay. I'll check it later. Thank you so much, sir, for joining in. So I was talking about white coat hypertension before you joined in. Now, white coat hypertension, I can describe it this way. It's actually elevation of blood pressure, elevated blood pressure that occurs in the hospital only when the individual checks normally at home or outside the hospital. It is normal. So for me as a doctor, what I ask doctors would, doctor would normally request that you have a chart of your own blood pressure measurements. Maybe for a week, you need to check in the morning and in the evening or at night before you go to bed. Preferably as you wake, you check it, and then at night. Sometimes you'll be asked to check during the day. So when you have that record for about a week or two, your doctor would like to see, and then compare with what is usually being measured in the hospital. So that way, that diagnosis of white coat hypertension can be made. Then there's the masked hypertension. Masked, as in masked, masked, masked. So wearing a mask. So a masked hypertension is that's that occurs when the individual's blood pressure is usually elevated at home, but when in the hospital, it's normal. It's normal. So that's masked hypertension. So those are two types. So sometimes the causes for people who have white coat hypertension are usually related to anxiety, the fear of white coats. When people see whether the nurse or the doctor checking, trying to check. In fact, the fear of even going to the hospital in the first place. I mean, some people have that fear of what are they going to find out? What is my doctor going to say today? What is the nurse going to measure today? Okay, so that fear, anxiety can make people have elevated blood pressure. So that's a form of stress. Okay, so there's a way we then counsel such an individual and then help them to navigate the condition. So how can blood pressure be lowered naturally? Some people don't want to use drugs. Thank you, Tech Informant. Thank you so much. Thank you for the feedback. Tech Informant says thank you for all you do to enlighten us about our health. Yes, you're welcome, sir. For those that don't know, Tech Informant is tech informant. I mean, when it comes to this YouTube and then talking about being a content creator and learning and doing and studying the algorithm and how to grow and how you've got to connect with tech informants. Interestingly, I'm a member. I have a membership on the channel. I'm going to make moderator. So you can check out his channel um, at any point in time. Okay. So thank you. You're welcome, Tech Informant. Just trying to do my beat. Okay. Um, do okay. I'm trying to read. Question: how can I lower my blood pressure naturally? Okay, so I mentioned some of these factors. 80% of heart attacks, cardiovascular diseases can be prevented. Yes, 80%, according to researches that have been done. In fact, the World Health Organization has also made that statement. So, what are the things that we can do naturally? Some people don't want to use drugs, and if you are here, let's get to know. Let's get to know you. Okay. Kindly remember to give this live a like. Like we say, please like this live. Double tap on your screen so that more people, maybe more people that we have currently can join in. Now, some people don't want to use medications, and um, even not your doctor. The doctor cannot even force you to use medications. Okay, but what can you do if you have that borderline? Um, you are tilting, and you have been warned, or you have been warned by your healthcare provider um, that you need to watch so that you don't tilt to having hypertension. Yes, an individual can have elevated blood pressure and not have hypertension. Okay, so that needs to be clear. Even though those terms could be used interchangeably, so it can be a temporary thing. It can be uh, an event thing that happens that an individual has elevated blood pressure, but uh, is not sustained, is not persistent. So the individual cannot be said to be hypertensive. All right. So, but for such a person that may develop due to one factor or the other, stress related, um, it could be due to an event, maybe uh, a life changing event that the individual experiences. It may even be during pregnancy. Okay. But there are things that can be done whether you are in the stage of being at the borderline, developing hypertension, or you have a diagnosis of hypertension. So what are the things that you can do? We have talked about some of those things. The need to reduce your salt intake. Moderate consumption is important. We live in an environment, in a community, or in nations, if you are on this side, in Africa, where uh, your our soil is salt naturally, so we have access to salt. Then consumption of foods, the more we consume, the more we have access to salt. So people we still add salt to our food, and so that, in a way, is giving more room for increased sodium salt intake, which is actually the major uh, culprit, the risk for developing um, high blood pressure. So you need to be reducing sodium salt intake and then potassium intake, preferably from fruits and vegetables. There's something we call dietary approach to stop hypertension. So there is a way that you can adjust your diet to avoid getting high blood pressure. So even if you have a family history, a positive family history of hypertension, maybe in one of the parents or in a close relative, um, you can prevent hypertension by making adjustments. And then if you have been diagnosed, you also need to make these adjustments. But as long drugs alone will not do it. So I need to emphasize that drugs alone will not do it. As long as you are still maintaining unhealthy habits, your blood pressure may not be controlled. So exercising 30 minutes, brisk walking every day, at least 5 days in a week is important. Then maintaining healthy weight. Being overweight or obese is a risk factor. In fact, an independent risk factor for developing cardiovascular diseases. We are talking about hypertension basically because it is the leading cause of cardiovascular disease globally. And cardiovascular disease are the leading cause of mortality or death all over the world. So, what next? Sleep 7 to 8 hours at least. Night sleep is very important. 7 to 8 hours of night sleep is very important. Wow. Let me check the charts. More of our people are joining in. Let me see who is here. This is Edo Amaka, Edo and family. Good to have you here. Good evening. Is it evening on your side too? Are you not in Europe? Where are you, please? Are you in the UK? Edo Amaka, Edo and family. Good to have you. Like done. Thank you for the like. Well appreciated. Thank you so much. Thank you. I can see you say I'm exercising. Oh, okay, that's great. We must be moving, you know. Exercise is just part of physical activity. You can stretch, um, you know, you can do a lot. Skipping, is a form of exercise. And the more we move, the better for us, okay? That's great. So, what type of exercises do you do? Edo Amaka Edo. How is the family? Good to have you here. You know, my wonderful content creators. Okay, you say I'm not sleeping up to that. So, whoa. So, how many hours do you sleep? Adam Amaka, how many hours do you sleep? No, you say um, sleep in terms of quality is important, then in terms of duration is important, but quality is more important than the quantity, really. Okay, so but if you sleep 8 hours and you don't feel rested, you don't feel strong waking up, then you may not really be having healthy sleep. But what is recommended is on the average at least 6 hours. But even if you sleep 5 hours and you feel rested, you wake up full of energy, ready to take on the world, then you are doing well. So Edamaka says sometimes 5 to 6 hours. Yes, understandable because you do a lot. Content creator, as a wife, as a mother, you know, business. So it's understandable. So, but that's still fair. 5 to 6 hours. Five. Then you say sometimes 8. So it's good. So the important thing is to understand your body and know when you have deprived yourself of the required number of hours or the rest that you should be getting. So you may need to catch up. And there's something called sleep debt that you are owing. So some people are really, really owing uh, that debt. If you are going to feel good with yourself, live healthy, be strong, be able to perform your task effectively, then you should not have sleep deprivations. Okay. Whether you're talking about physical work or mental work, you need to be well rested. You need to be sure that you are renewing yourself, refreshing yourself, and that's important. I'm sure you know that you are able to perform better when you are well rested. Even for content creation, if you want to sit in front of your camera, you want to shoot a video, there's really not much that you can do when you are not feeling refreshed and feeling good. There are some content that you can actually do with uh, stress, okay, but your performance may be better when you are well rested. So you should learn to manage stress. So that's another point. That's one way to manage blood pressure. Stress is a factor. People say, oh, they are not stressed, they are stressed. Stress is a factor. So when people are able to cope or handle stress, they can also uh, handle their blood pressure well. Okay, so if you have any question, please drop in the chat, and remember to like this live. It's getting more interesting with more people joining in from different parts of the world. Okay, so Edo Amaka Edo says, I work, mommy, and exercise every 5 days. Yeah, that's true. You do a lot, and that's good. You do morning. Okay, you work and you're a mother. Yes, exercise every 5 days. You create content by doing live every day after work to exercise. Now tell me how you do that. How do you exercise creating content after work? What type of content? Okay, in the kitchen. Okay, I think I've seen you exercise on your live sometimes. So, what do you actually mean by um, you create content by going live every day? Yes, you go live. Yes, after work to exercise. Okay, so your content creation is what you are describing as exercise. Is it? Is that what you mean? That's the fact that you are creating content means okay. Hmm. Yeah, it's a form of activity. So if it requires you standing, moving, sitting, you know, it's a form of activity, and that's helpful. But if you can ensure that you are walking, at least brisk walking, 30 minutes, 20 to 30 minutes, you know, every day, it's good for you. So, what can happen if we do not take care of our hearts? What can happen? We need to know so that this not to bring fear, but to help us to have some caution and to pay more attention to our heart. The same way, if you leave a field or a farm, or you plant a seed and you do not do anything about it, you do not allow access to water, you do not allow access to the sunlight, you know, so many things can happen. That seed may not germinate, may not grow. Now, your heart also needs nourishment. So, what are the things that can happen to the heart that can make it not to perform its function? The first thing that we emphasize has to do with hypertension. So if the heart is now beginning to work so hard to compensate for the blood pressure, the level of pressure, then that accommodation may not continue forever. And so at a point, the heart begins to fail. So it's not able to push or pump blood as it should. So the individual begins to reflect some things like facial swelling, pedal swelling, easy fatigability. The individual may even be coughing, talking about heart failure. So there's a way this diagnosis is made, and there's a way the management goes. So usually this happens in individuals who mostly do not have good blood pressure control, people who have not been regular with their medications, or who have not followed the proper plan for the management of their condition. Okay, so that's not a good condition at all. So other factors, what are the other things that can cause damage to the heart? High cholesterol levels. We must be talking about that. The same process, the same way people consume a lot of processed foods these days, sedentary lifestyle. So there's a tendency to eat more salty, more fried foods, and then high level consumption of fats, bad fats for that matter, can lead to plugging of those blood vessels. And if that happens in the heart, that will limit the flow of blood to the heart, because the heart itself receives nourishment, receives blood supply to the heart, to itself, so I can continue to perform its function. So for any reason, if there is a shortage or a blockage in the blood vessel that should be supplying the heart, then that heart can also suffer, and its function can be terminated. Okay, so you say somebody has a heart attack, myocardial infarction. So if you are going to be paying attention to your heart, one of the things that you must be doing is to monitor these things. You're not just monitoring your blood pressure, you should also be monitoring your cholesterol levels. So for every one of us as adults, these are tests that you must be doing. And don't don't think that some people think, oh, when we say fat, I'm not fat. No, no, it's not about the you're not talking about your body mass index. You're not talking about your weight around your height. We're talking about the consumption that may not even reflect in your physique. The individual may have high levels of cholesterol and may not be overweight or obese. So we have seen that happen. So that's why your doctor may ask you to check these things. We need to run a cholesterol level check. That's a lipid profile to check for total cholesterol, check for low density lipoprotein, that's the bad cholesterol, HDL, high density lipoprotein, triglycerides. So these parameters have ranges that need to be monitored appropriately. So those are some of the things that can happen to the heart, and the heart can fail. And also, if blood pressure is not controlled, it can also affect the kidneys. Can affect the kidneys. Kidney will not be able to perform its function. There will be initial increase in passage of large volumes of urine. Individual may also, at some point later, not be able to pass urine. So when the individual comes to a point of renal failure, you know what that means. They begin to talk about dialysis, or even kidney transplant. So those are the consequences of not paying attention to the heart. So we must be paying attention to our heart. We must be doing the needful. It's a conscious effort. We must be doing these things like getting fruits, vegetables, drinking water, avoiding processed foods as much as possible. These are the things that we must be doing. Yes, Edo says processed food is so dangerous. Yes, it is, but when it comes to the taste, the sweetness, it's there, and that's way it's tempting, and it's actually a habit that can be developed, but you can also deal with it and avoid that negative habit. We have to even train our children to be cautious, to avoid overconsumption of these things. Even though even adults sometimes indulge, but we need to be sure that we are living consciously, making healthy choices for our own lives. All right. So I was talking about the complications. I also need to mention stroke, which is also a common complication from cardiovascular risk. Individuals individual may suffer from um, thromboembolic stroke or hemorrhagic stroke. Thromboembolic meaning that there is a clot formation in the blood vessel supplying a particular part of the brain, and then the individual may have some weakness or some form of deficiency in a particular area that's affected. But hemorrhagic, the bleeding occurring in a particular part of the brain. Okay, so whether hemorrhagic or thromboembolic, stroke is not a good thing. So it can also be prevented when the measures that we mentioned earlier are put in place. So after diagnosis, emphasis on management so that these complications can be prevented. Now, I need to mention also that there are some of these conditions are like twins. If somebody has hypertension, there's a tendency to develop diabetes, there's a tendency to have high levels of cholesterol. So these are things that your doctor would also normally request for to check and screen you for. Okay. Any other area that we are yet to cover? So medications, definitely, some individuals may be placed on certain medications, and you have to follow the prescription. And if you have any questions relating to your use of medication, then you should speak with your doctor for proper guidance. All right. And I've talked about lifestyle changes. Then let me just mention some of the things that I found out that people who are on management, who are on management, what they do. Okay. Sometimes people do not take their medications even before coming to the hospital, and that is not proper. Okay. I don't know if you know anyone who is hypertensive, but because they need to see their doctor, they choose not to take medications on that day or that morning. It's not actually good, because stroke will not choose where it's going to happen, whether you're on your way to your doctor's office or you're on your way to a party. So if you don't take your medications, an individual who is hypertensive who does not take his medication may actually develop a complication and may not be predictable. The type and the time cannot be predicted. All right, so you must be taking your medications. Now, some people say because they've not eaten, so they have not taken their medications, so they don't take their medications as prescribed. Many of the antihypertensives do not need food to work. Okay, so take your medications even without food. Yes, for antihypertensives. Some other medications require food. Okay, now even for people who are being planned for surgery, and if they are hypertensive, they are still being asked to take their dose of antihypertensive on the morning of surgery with some little water. So that's part of what I've seen people say or do. Okay. Some people also share medications. That's not acceptable. There are different antihypertensives. And so there is usually this personalized prescriptions for you based on other factors that your doctor may be considering. So you cannot just decide to take another type of antihypertensive, that belongs to another. All right. Of course, if you need to make any changes, you need to consult with your doctor to determine the right adjustments for your medications. Okay. What else have I observed? Some people just think about the long-term effect of taking medications. So what I say is this: if you are thinking, oh, you don't want to take medications for this because you have a fear or you think that it may cause harm, I need to let you know that the complications that arise from hypertension, the risk of complications is worse than your regular intake of your medications. Okay, so I want to encourage somebody here to ensure that they are regular with their medication. Okay, Ackman 87 says Bro, I'm back. Welcome back, Akman. Good to have you back. I thought you were going to sleep. We've had a number of people join in since you left, so you can check them out. Now, Akman says, okay, Edu Amaka says, why do some people in Nigeria sell bad medicines? Okay, thank God you said some people. There's usually a regulation for opening a pharmacy store, drugstore. Um, but people sometimes just take take things by themselves to decide to be selling medications without license. Okay, so we need to check where we are getting what from. So when you have reputable pharmacies around or within the hospital that you use, some of these challenges will be avoided. All right. Hmm. So there are a number of factors when it comes to talking about bad medicine. When it comes to the efficiency, some factor like the environment. If there's no cooling environment, the right temperature for preserving the medication can also be a cause. Thank you, Akman. Saying cool. And someone was sick, but the medication wasn't working, leads to hepatitis. Uh, this is not clear, but there are so many factors. If you're talking about hepatitis, I can see, is it hypertension you want to say, or hepatitis? Hepatitis, depending on the type, it's a viral infection. Usually, blood can affect the liver and then can be transmitted actually through the for hepatitis B and D through uh, blood, the fluids that may be exchanged from one person that is infected to another. But for hepatitis A and E, usually through the fecal oral route from consumption. Okay, so those are the ways. Of course, medication can also affect the liver. For example, high level of consumption of paracetamol can also lead to inflammation in the liver, and some other medications also. Okay, you said lead to hepatitis. Okay, so that's why it's always good to look for a reputable center for your health care needs, and I'm sure that will be helpful to help to prevent or avoid um, strange developments due to medical errors. Right. Thank you for engaging. Who is just joining in? Let's know where you are joining from. So I believe it's been interesting watching, hearing, listening to me talk about this um, art on this World Art Day. Okay, Edamaka says, thank you so much. You're welcome. You're welcome. You're welcome. When was the last time you had your blood pressure check? When was the last time you had a blood pressure check? That's very important. Is there anyone with any question as we gradually move towards the end of this session? All right. So thank you everyone for tuning in. Thank you for engaging. I really appreciate your participation on this live. It was really engaging. Um, Edoamaka says last month. Yes, very good. It's good to know that you checked last month. All right, so just keep it up. I'm sure God is faithful. He will continue to keep us healthy. So I'm going to see you again soon. So watch out. If you are yet to watch those new videos on arthritis, kindly watch them. I mean, you are going to learn a lot. Talking about natural remedies for the treatment of arthritis. And then looking forward to more uh, new videos and more posts, more live sessions as we go together. Thank you. Thank you, Marka. Thank you so much for committing to go to watch. And let me know in the comments what you think. And I mean, someone around you may also benefit. Thank you so much. I'll see you all again soon. Bye.